Hi class, this is Kelly Woods and I did my presentation on diabetes education. And I'm just going to start with my PowerPoint presentation. It was titled Diabetes Education, Taking Responsibility for Our Health and Well-Being. An overview about diabetes is that it's a chronic, debilitating disease that affects every aspect of one's life. It affects everything from the circulatory system to the vision, teeth, gums, and causes complications during pregnancy. It's responsible for severe health complications, including amputation, kidney failure, blindness, heart disease. It is characterized by elevated blood sugar levels. The blood glucose. The human body needs blood glucose as the primary energy source. Every single cell of the human body needs the blood glucose for energy. Insulin is a hormone produced and released by the pancreas into the bloodstream, and the insulin accompanies the glucose into each cell of the body via the bloodstream. If this action does not occur, blood glucose levels remain elevated and the cells don't get any energy. And diabetes occurs when blood sugar levels remain high for a period of time. Signs and symptoms include increased urine, increased thirst, fatigue, excessive hunger, unexplained weight loss, slow wound healing, dry, flaky skin, blurry vision, sensations of pins and needles in the feet, loss of feeling in the feet. Statistics prove diabetes increases substantially every year. By 2014, 21 million Americans are diagnosed diabetics. Another 8.1 million were undiagnosed diabetics. Appropriate diabetes management protects the health and well-being of the diabetes population. I did a quick overview of the three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational. For this project, I primarily went over type 2 diabetes. A quick overview of type 1 diabetes. It occurs mainly in the younger population, which is why it's referred to as juvenile diabetes. In this type of diabetes, the body does not produce enough insulin. In this type of diabetes, there's the need for use of synthetic insulin. They may also use oral medications as well, and they may also be on dietary restrictions. Type 2 diabetes, also referred to as adult onset, usually occurs in middle to older adults. People who are obese or have sedentary lifestyles are more susceptible. Risk factors for this include a family history of diabetes, someone who had gestational diabetes, and someone who is overweight or is obese. A large portion of these cases can be prevented. Presently, 1 in 3 Americans will have type 2 diabetes within their life. Gestational diabetes occurs during pregnancy because certain hormones are produced which causes insulin resistance. Obese women and those who gain too much weight during pregnancy are at higher risk for gestational diabetes, and this gestational diabetes resolves after childbirth. However, those who get gestational diabetes are at higher risk for developing type 2 diabetes later on in life. Health outcomes for diabetes is plain and simple. It is fatal if not treated. Diabetes causes irreversible damage to all major organs and body systems, reduces the life expectancy by 15 years. Diagnosis of diabetes should be taken seriously, and 50% of those who are diagnosed are non-compliant. Effective diabetes management should include effective healthcare team collaboration. Having the right information and effective healthcare team is crucial to effective diabetes management. Adding an endocrinologist and a diabetic educator would increase the specialized plan of care. Also, adding counselor, an optometrist, dentist, pharmacist, and podiatrist would also even add further, more specialized care to the plan. Reducing risk factors is a great way to also be more effective in the management of diabetes. Diabetics are twice as likely to suffer stroke or heart attacks than non-diabetics. Therefore, an important part of diabetic management is decreasing risks for heart disease. Factors such as smoking cessation, managing cholesterol levels, and managing blood pressure issues are very important. Appropriate blood glucose maintenance is vital, keeping blood sugar levels within normal limits. minimizes the chance of complications from diabetes, such as kidney failure, vision issues, nerve problems. Such issues as hypoglycemia can cause altered mental status, coma, and even death. Appropriate glucose monitoring and maintenance, usually with type 1 diabetics, they use insulin. Type 2 diabetics use insulin. They use by mouth pills. They are encouraged to have a healthy weight and be compliant with their plan and to exercise. Diabetic management resources. Managing diabetes is a daily challenge. It has many factors that come with it. Each and every day presents new challenges. Diabetic sufferers have to constantly be factoring in what types of food they eat, how much food they eat. Daily blood sugar management is a juggling act. They also have to factor in exercise, daily stress. All those can affect and do affect their blood glucose levels. Federal resources include the Diabetic Research Institute. They have many brochures in various languages for diabetic management. They offer independent and group diabetic management classes and support groups. The Mayo Clinic has several books, DVDs, and website options. They also have a diabetes management package. State resources include the Illinois Department of Public Health. They have brochures which include topics such as fact sheets, impacts on diabetes, support, all kinds of different information. They have programs. They have a program called Illinois Diabetes Prevention and Control Program that puts together a lot of different classes and support groups. IDPH finances several evidence-supported programs throughout Illinois, and they offer several free workshops which are open to the general public. In 2011, IDPH Diabetes Prevention and Control Program presented local agencies with grants to initiate the Chronic Disease Self-Management Program and Diabetes Self-Management Program. Presently, 18 agencies have initiated programs covering over 24 counties. Local resources include the St. Mary's Hospital, having chronic disease managers, and one of their chronic disease diagnoses is diabetes. 2 local hospitals have a diabetes educator who operates by the set ADA standards. Early diabetes detection. Key factors are minimizing and preventing disease progression. Frequent visits to every physician on their plan of care. Smoking cessation is very important. Routine blood pressure monitoring also is extremely important. And managing maintaining the lipid management, keeping your cholesterol levels within normal limits. Diabetes prevention. 1/3 of all diabetics are unaware they have it. Most type 2 diabetics have no signs and symptoms originally. Only 5% of those who suffer from diabetes suffer from type 1, and most diabetic sufferers have type 2. And type 2 diabetes is preventable with weight loss and exercise. So increasing physical activity, consuming healthy food, and finding other pleasures besides food are all ways to lower the risk of type 2 diabetes. Childhood obesity prevention. Increasing the rate of childhood obesity is alarming. The increasing rate of childhood obesity is alarming. Obesity associated with type 2 diabetes risk factors associated with childhood obesity are type 2 diabetes, apnea, heart disease, and asthma. First Lady Michelle Obama initiated a program called Let's Move, and the goal is to tackle childhood obesity, and it is to teach healthy eating, encourage exercise, and to encourage the entire family to make these changes together. Childhood obesity prevention includes encouraging increased activity, daily opportunities to increase activity, and pushing a minimum of 30 minutes a day, 5 days a week. Diet, they're encouraging improved healthy eating, minimizing the consumption of high-fat foods, such as fried foods and whole milk. They are encouraging the selection of healthy options, such as whole grains, vegetables, and fruits, and teaching adequate portion sizes, and encouraging the implementation of daily requirements of the USDA 5 basic food groups. Diabetes prevention resources. The root cause of prediabetes, diabetes, and the associated disorders are unknown. Researchers in the Artificial Pancreas Lab in the Mayo Clinic are working on discovering the cause so more innovative treatments can be discovered. Leaders in diabetic investigation, the Mayo Clinic, are manufacturing a way for the human body to regenerate beta cells, which are insulin-producing cells. They are also producing more innovative technologies for diabetes sufferers. One program involves constant glucose monitoring, which is a really cool advanced computer program. It's an insulin pump which gauges the blood glucose levels, then acts accordingly. They are investigating what causes irregular glucose metabolism in diabetics, so that's pretty neat. The CDC initiated a program called Prevent Diabetes Stat, which was developed to tackle the increased incidence of type 2 diabetes, and the goal is to bring prediabetes to the nation's forefront as both serious and critical. And it provides toolkits for, it's to guide primary physicians on more effective ways to screen their patients and to better identify at-risk patients, and also promotes lifestyle changes. The CDC also offers a national registry of approved diabetes prevention programs available all over the U.S. Each recommended program uses evidence-based modules which meet specific CDC requirements. The U.S. Preventive Service Task Force consists of a panel of volunteer medical professionals who provide evidence-based recommendations regarding preventive services like preventive medicines and screenings. And the National Diabetes Education Program offers resources to both organizations and individuals independently and helping them cope and deal with this chronic disease. State resources. In Illinois, approximately 800,000 individuals have diabetes, and at least another 500,000 are unaware of the fact that they have it. Current statistics and trends inspired the ADA's Springfield office to be dedicated more than ever to raising awareness of the severity of diabetes. So 2 main offices in Chicago, one in Springfield and one in Chicago, have been opened. And they are educating the public and promoting volunteering. And the IDPA, the Illinois Department of Public Health, has created a collaborative approach called CATCH, Coordinated Approach to Child Health. It's a school-based program designed to promote healthy habits and behaviors everywhere. Locally, the Marion County Health Department in Salem, Illinois, offers blood pressure screening, blood sugar testing, lab services, tobacco education, smoking cessation, cardiovascular health education, nutrition education. Most of this is by appointment. The Felician Wellness Center, in collaboration with the Centralia Rec Center, offers 5 different programs for poor health and people who are at risk for poor health. Identified issues with diabetes management and compliance. Diabetes patient education processes identified weaknesses. 3 factors included: inadequate trainers, poor education plan, unorganized education plan. Statistics prove that education is key to effective diabetes management. Other issues included healthy behavior modification and culturally designed information. Merely providing a patient with papers on how to manage diabetes is not enough. Success has been proven when behavior change is demonstrated. Patients need support and reinforcement. Successful programs include lifestyle coaching, and this offers support and nutrition in a real-life setting. Specific goal-oriented, individualized programs have been proven effective to efficiently change lifestyle behaviors and provide the support so people maintain the same behavior changes. Other identified issues with maintenance and compliance include age. Age plays a huge role in compliance. A recent government announcement reported that 1 in 5 young diabetic adults ranging from 18 to 39 have failed to follow up with a physician in greater than 6 months. Science proves young adults are not taking diabetes seriously. Research shows less compliance and adherence to the diabetes management plan of care for young adults. The goal of this healthcare plan I initially was going to present my community health project at a health fair and it fell through. My initial goal was to increase participant knowledge of the severity of diabetes, the importance of diabetes prevention, and the significance of providing support to diabetic sufferers. The aim was at shedding light on the current trend upward on the number of Americans with prediabetes, diabetes, and risk factors for both, in an effort to encourage a responsibility to health and wellness. The long-term goal was to by providing this information, others would be able to practice healthier lifestyle choices and eliminate or decrease risk factors and reduce risks of developing type 2 diabetes. And the specific behavior objectives that I chose were upon completion of this presentation's introduction and review of research literature, each audience member will have been presented with enough relevant information to have a basic understanding of diabetes. Upon reviewing the research literature, 75% of the audience will be able to recite the 3 main types of diabetes, and after completion of the community health project, each audience member will be able to recite at least one local resource available for the diabetes management.